Hello guys, hope you're all okay. You're all enjoying your life and you're also enjoying watching my videos. I'm Dr. Arshad Nadeem Awan with my YouTube channel related to ultrasound and radiology imaging. So the topic of discussion today is the scrotal masses. Scrotal masses, actually it includes the three compartments. In the scrotal area there is testes, there are extra testicular spaces, and beside this there will also be involvement of the paratesticular region. Like for example, there might be hydrocele, there may be epididymal cyst, there may be lipoma, there may be liposarcoma, metastatic deposit related to the scrotal wall, maybe abscess. There are a lot many things in the differential. So when you're doing scrotal ultrasound, you should have to have all these things in your mind, and in the differential you should have couple of points with you. So this particular video is for the differential diagnosis. I'm going to discuss about the differential diagnosis related to the intrascrotal compartments, parascrotal areas, and extra I would say testicular regions as well. So let's start looking for all these differential diagnoses. It will definitely enhance your knowledge, it will enhance your vocabulary and also your power of differential diagnosis. So let's start watching a video. Most frequent conditions related to scrotal masses include, on the top is inflammation, like architis is the one of the major reason for the scrotal mass. You can feel that there is a mass, but actually this will be inflammation, and the other sign of inflammation will also be there. The second common one is the hydrocele. It could be clear fluid hydrocele or maybe infected hydrocele. Beside this, torsion will also be there, which will appear as a scrotal mass, but there will be a severe pain and the patient will be in serious or in severe agony. Varicocele is the another reason the patient will complain of a scrotal mass, but it will be like a bunch of grapes. He will be able to feel that. In few beings it will be associated with the pain. Spermatocele is the cyst where there is a retention of the sperms within it. Most often it remains silent unless it is infected. In sixth category there will be simple cysts, so that's again happens to be quite I would say asymptomatic. Malignant tumors, there are quite a few malignant tumors, and the malignant tumor often remains silent until it is properly diagnosed. The another point is the benign tumor. Benign tumor will also give rise to a scrotal mass, but it depends on whether it gives rise to symptoms or not. The one thing you must keep in mind that the sonographic differentiation of intratesticular masses from the extra testicular masses is the accurate. This is the accurate modalities to differentiate between the intratesticular and extratesticular masses. Paratesticular lesions include epididymal cyst. It is the most commonest epididymal mass, and after that adenomatoid tumor is the common one. Scrotal tunica cysts are also very common. It gives rise to appearance as it's a scrotal mass, and tunica albuginea cyst. These two are the layers covering the testes, tunica albuginea and tunica vaginalis, and from these two layers many a time the cysts arises which give rise to a scrotal, which give rise to appearance of the scrotal mass. Hydrocele, as we have mentioned, it's a paratesticular lesion and it appears to be a scrotal mass. Scrotal hematocele, this is another post-traumatic, and there will be history of trauma as well. Varicocele, again the patient will complain of like there is a bunch of grape, particularly on the left side, and if it is on the right side, must look for the renal abnormality and always do the kidney scan. There are quite a few extra testicular scrotal masses which happens to be benign, like the lipoma is the most common extra testicular tumor. Leiomyoma of the scrotum is common. You may come across neurofibroma, neural or granular cell tumor is the another form. Angiomyofibroblastoma, it looks like a tumor. It will also involve the extra testicular compartment. Fibrous pseudotumor, actually it's a fibrous tissues, but it gives rise to appearance of the scrotal mass. And fibrous hematoma of the infancy is another tumor which will contribute into the extra testicular scrotal masses. Quite a few malignant tumors related to the extra testicular compartment includes metastasis. It's a very common one, particularly from the prostate carcinoma. Liposarcoma is another one. Leiomyosarcoma of the scrotum is on the list as well. Malignant fibrous histiocytoma and rhabdomyosarcoma is the another extra testicular malignant tumors, and primary dermal lesion which may extend into the scrotal wall, and that could be the melanoma. So all these are the differential diagnosis. Whenever you are scanning, you must keep all these in view, and beside this there will be a particular sign and symptoms. There may be a history. Take the history, look for the appearance, look for whether this is intra compartment, extra compartment, is a paratesticular. So all these information you can include on your ultrasound report.